So what's a sprain again? Injury to what? What's a sprain? Injury to a ligament. Exactly. Now, sprain is an injury to a ligament. Okay, this is the most common wrist injuries that we can talk about. Okay. Now, the most common cause for an injury to the wrist is again falling on an outstretched hand. Right. Of course, it's always tenderness at the location of the injury, with a limited range of motion. I'm sure people have felt it before. I mean, not something severe, but sometimes you fall on your hands and you feel this sharp pain deep inside and you're having trouble moving your wrist, and there's tenderness where you hit it. Okay? There might be bruising. And the thing about a sprain of the wrist, when it's severe, is that you have to rule out fractures of the wrist. The reason is there's a very small blood vessel, an artery, that passes through one of the biggest wrist bones, the scaphoid. Okay? And if the scaphoid gets fractured, the pieces, the fragments, can actually sever that blood vessel. And unless it's fixed promptly, it can lead to necrosis of that bone. Okay? Now, testing for a wrist sprain, like I said, this is a diagnosis of exclusion. You exclude fractures, then you can say it's a sprain. You exclude dislocation, you can say it's a sprain. All right. Actually, I know someone who fell outstretched hand. Since that day, she had a little deformity in the back of her hand. Something like a little bone sticking out. You know, not here.